Vaughn Gillette's YouTube channel. The topic of today is lateral pelvic tilt, which can cause hip or low back pain. We're going to go through an assessment, some postural correction, and some strength training exercises to help you get neutral. Check it out. Whenever we're assessing for a lateral pelvic tilt, we want to first make sure that we warm up those sides and don't tickle our clients by sticking our fingers into the sides abruptly. We want to warm up like this and gently press into the sides on the top of the pelvis. What we're looking for is a 1/2 inch or a greater difference between each side. You can have the feet together or apart. I don't find that it makes much of a difference. Now in this assessment, I'm using butter knives at my sides because I want to make sure that I can accurately detect any difference side to side, which can be a little challenging with the fingers if you're looking in a mirror. What I advise is you take a video of yourself. The video is going to give you some pretty objective feedback. Sometimes our brain definitely interprets things in a weird way. In this last assessment, we're just going to spread our legs apart, and if we see a full correction, that tells us this video is the right way to go for our corrections. However, if you spread your legs and you find that it doesn't really change anything, then I do not advise proceeding with these corrections, but we will get to that in later videos, which might already be up. So getting into the corrections, we're going to go through the sitting, the standing, and the lying down. Now in this video, if I had an elevated right pelvis, I'm going to put something underneath my left pelvis to elevate it. So you can see that when I'm sitting down, we want to make sure that I am as vertical as possible and I am not leaning at all. A lot of times what I find when people do this is they'll just give in to that lateral elevated right pelvic tilt, for instance, and then they're just going to lean in a little bit, often towards the left, and it could be also towards the right side. But we definitely don't want any leaning because that can exacerbate a curved spine, which you already have if you do have a lateral pelvic tilt. So we definitely don't want to rotate because this can negate our correction. Now in standing, assuming that I had a elevated left pelvis, I could stand like this, and as you can see, my pelvis on the right is elevated while my pelvis on the left is excuse me, is lower. Now if I had an elevated right pelvis, I would stand on my left leg primarily, whereby the left pelvis would be elevated compared to the right. I find standing is very effective when people stand a lot. If you do stand a lot, this is going to be a perfect correction for you. You can also stand symmetrical and sort of lean onto one foot, making sure that your pelvis is level, but generally even standing up can still promote a lateral pelvic tilt that isn't correctable, but you can still kind of do it while standing. Now lying down, this is sometimes what I'll see, especially for people who have a larger, wider pelvis. If they sleep, for instance, on their left side, their right pelvis may be shifted vertically, or in this case up towards my head, and this can be a cause of many lateral pelvic tilts. So in this case, as you can see, I put a pillow underneath my lower torso, and that helps to balance it out to make sure that my pelvis is level. Similarly, if I might have the reverse problem, so you could do the opposite on the other side. If you have any questions or comments, please post them below. Thank you.